As you join, drop in the chat, where are you joining from? You know, I like to know where you all are joining from. And if you have any questions, drop them. I am going to be going over the top 5 questions we've been asked the most lately here at Inspire Primary Care. But if you have any questions, drop them. I'll answer your questions live as well. For those of you who are new here, and it has been a minute since I've gone live, so those of you who are new and are not familiar with me, I'm Dr. Jade. I'm a board-certified family medicine physician. I'm certified in obesity medicine. I'm the founder and medical director over at Inspire Primary Care. We are a concierge-style membership medical practice that is focused on providing high-quality, wellness-focused primary care and medical weight loss services to the Las Vegas Valley. And this is my hometown. I'm so excited on how amazing it has been to provide my hometown with quality health care. We know that Las Vegas is not only a desert, but a medical desert. Very few primary care physicians to the population, and it's very hard to find quality primary care in the Las Vegas Valley, but Inspire Primary Care is here to be a solution to that problem, okay? No more saying that there's no quality primary care in Las Vegas. The answer should be, yes, there is. There's Inspire Primary Care. So super excited. As you all are joining, drop in the chat where are you joining from. And I'm going to get to the top 5 questions, all right? And I'll be looking at the chat to see if you have any questions as well live, all right? Oh, if you are new here and you're like, wait, there's quality primary care in Las Vegas, there's a membership, like what is that? How does that work? Stay tuned. It's going to be answered in the 5 questions. But if you've been looking for quality healthcare, if you're a busy professional, a family, or if you're a business owner with a team, we'd love to care for you and your whole team. We'll talk about that with the corporate membership. But we'd love to care for you. We're now enrolling new members at Inspire Primary Care, and we're enrolling new members for the month of May. How crazy is that we're already coming up on May? So definitely just join us at inspireprimarycare.com. No I in front of Inspire. And that is how you join. Drop in the chat where you're joining from. I see some of you all joining. Okay, question number 1. Drop any questions you have. Happy to answer your questions. And I'm going to answer the top 5. Okay. So question number 1, what I've been getting asked lately on our meet and greets a lot is what's included in the membership? What is included in the membership at Inspire Primary Care? So again, Inspire Primary Care is a membership medical practice. And many people will say, like, what is that? This is not a new style of healthcare. Membership medical practices or direct primary care practices have been around for over a decade now. There's over 5,000 physician-owned practices across the United States, and there's a handful of us here in Las Vegas. What that is, you can think of it like a gym membership, but for primary care, 90% of your healthcare needs covered. But to provide quality primary care, we've been forced to remove insurance from the primary care office. And instead, we have an innovative style of practicing with a membership. So just like a gym membership or a Costco membership or a Netflix membership, you get all of your primary care covered, which is 90% of healthcare needs, for a flat monthly or annual membership, okay? So then the question is, what's included in the membership, all right? Again, primary care is 90% of your healthcare needs. Very few things fall outside of the primary care office. So things included in your membership are going to be all the things you would go to urgent care for. Okay. You wake up with that urinary tract infection, you have a cough, you have, an accident that happened, any urgent care needs, an ear infection, rashes, etc. So all your urgent care needs. All right. We're an easy text message away, email away. We'll get to that. Okay. But your healthcare team is right at your fingertips for all your urgent care needs. Chronic care needs, right? So if we diagnose you with something or you have a chronic diagnosis, such as type 2 diabetes, high blood pressure, high cholesterol, we manage that, all right? All included in your membership. What else? Procedures, all of the procedures that we do in office at a primary care office. So we have a whole list of our procedures. Common procedures we do in our office are skin tag removals. If you cut yourself open, need to be sewed up, a laceration repair, joint injections, etc. All of those are included in your membership. Pap smears, that's our most common procedure, is the pap smear. Yes, that is covered in our office. In addition to urgent care, chronic care, and procedures, also your preventive care, right? So all of the things that help to prevent chronic diseases. We're big on the wellness focused aspect. So we want to help keep our members healthy. We want to help you transition to a healthier lifestyle and a healthier weight through our wellness visits and our personalized wellness plans, but also those those screenings, right? So we're making sure you're up to date on your mammograms. We're making sure you're up to date on those colonoscopies, etc. Okay, so you get the point. All of your prevention as well. So what didn't I cover? The 10% of healthcare, which is basically surgeries, hospitalizations, and if you need to be referred to a specialist, that's the 10% of care that falls outside of our office. All of the other care, that 90%, is covered under your membership, all right? So that's what's covered. Drop in the chat. I see more of you all joining. Drop in the chat. Where are you joining from? And also, if you have any questions about Inspire Primary Care, drop it below. We're answering the top 5 questions. Okay, question number 1 is behind us. Check done. Okay, here we go. Number 2. The number 2 question I've been asked the most on our meet and greets lately is, tell me about the direct access. Like, what do you mean that the healthcare team is directly accessible to the healthcare team and the physician? All right. So this is one of the benefits of Inspire Primary Care and our membership is your healthcare team, your personal healthcare team is at your fingertips, an easy text message away, an email away. So this is how it works. You wake up, you have a question, a concern, a health issue. You text our team. When I say our healthcare team, I'm the physician of the practice. Oh, I see Las Vegas. I'm going to see, how do I say this? I'm going to say Harmony. Harmony Danger is from Las Vegas. All right. Hi. Thank you for joining. And you're from Las Vegas. So yes, do you have quality primary care? That's what I want to know. That's always my opening question because usually the answer is nah. Okay. But we have to change that. All right. With Inspire Primary Care. So direct access. Your team's an easy text message away. So all of our members of our practice have their own personal member number. So when they have a question or a concern, they text our practice and our healthcare team during business hours. I was telling you what I mean by healthcare team. So I'm the physician of the practice and the medical director. So if there are any questions that are text to our team and it's about your symptoms or things that basically the doctor should answer, then I would be the one to answer that. But we also have amazing practice assistants for all of our clinical support. So if you ask a question like, hey, did you send my refill? Did you send a referral? What's the address to the practice? All of those type of questions, then our practice assistants will answer those. So your whole healthcare team is at your fingertips. So we're a text message away during business hours. You text us during business hours, we text you back. If it's after hours, email is 24/7 at our practice. So you can email anytime. If it's an urgent concern after hours, then our members know how to put urgent in the subject line, and then I'll check those out after hours. But otherwise, we answer emails within a business day. We answer text messages same day. And then all of our members have their own self-scheduling link where they self-schedule their follow-up appointments. So when they go into their self-scheduling link, they choose phone, video, or in office, and they choose how they want their appointments. And if you choose Zoom, then I hop on Zoom. If you choose phone, I call you. And if you choose in office, then I meet you here at Inspire Primary Care. So that is how the direct access works. Your healthcare team is an easy text, email, phone, video, or in office away. There's no excuses to avoid your doctor. All right, so that's answering that. And drop your questions. I'm going to answer your questions. I'm going to go through the top 5 and then I'm going to answer your questions. Drop them below. And also let me know where you guys joining from. Thank you for being here. I see y'all in the chat. Okay, here we go. Question number 3. I've been getting asked a lot about the corporate option here at Inspire Primary Care. I know we've been putting the word out over the last year. The corporate side of our practice really has taken off. Many of you have been asking, like, where are you at? Why haven't you been going live? Well, Inspire Primary Care has had a growth spurt specifically through our corporate side. And so basically for our small and medium-sized businesses in Las Vegas, on the retail side, if you're an individual, a busy professional, a family, you're still welcome to join our practice. We love to care for you. You can join as individuals, right? However, the corporate side of our practice is an offering specifically for small and medium-sized businesses in Las Vegas, which has been amazing. So what has happened is healthcare is so astronomically expensive for businesses, also individuals, but for businesses, that many small and medium businesses are not offering any benefits anymore to people because they just can't. So they hire you, but they can't offer benefits. So Inspire Primary Care has become a solution to that problem. And small and medium-sized businesses, typically business owners with teams of 5 to 30 employees, have now offered Inspire Primary Care as the healthcare benefit to their employees. And they pay either for 100% of the membership or 50% of the membership. And it has been so awesome for that concierge style healthcare to be an offering for employers to their employees and their teams. So if you're a business owner and you're watching this and you're like, oh, it's been so hard to provide benefits to my team, reach out to us. Just email us. If you go to inspireprimarycare.com, no I in front of Inspire, the contact page comes directly to me. So go there and just email us, and we'll set you up for a corporate meet and greet with me so I can explain more on how that works and get your team set up. But it's been amazing to take care of teams and businesses throughout the Valley. So that's been huge. All right. So if you're an employer watching this and you're like, I want some quality benefits for my team, you want to keep your employees healthy, their doctor will be a texted email away. There will be no excuse. They won't be at urgent care and calling off and all these things. We'd love to care for you and your team and make the healthcare benefit affordable for your business. If you are employed somewhere and you're watching this and you're like, my employer hasn't been giving us benefits or our benefits are trash, then connect them with us, all right? We would love to talk to your employer and let them know that there is a better way, okay? So that's the corporate healthcare option, and I've been getting a lot of questions about that. And to all my corporate partners that are watching, thank you so much for being an Inspire Primary Care corporate partner. It is a pleasure to care for you and your team. All right, I'm going to read, before I go on to number 4, I'm going to read down in the chat. All right, the joy to the world. Oh, I love that. Is also from Las Vegas. Welcome. Thank you for being here. Drop your questions, y'all. I will answer them. So, okay. So going back up to Harmony 3, it says Harmony, but there's a 3 for Harmony. Okay. Forgive me if I'm saying it wrong, okay? But danger. It says, my coworker asked, what about, come on, y'all better be over lunch watching this together. Okay, all right, let me focus. My coworker asked, what about contraception, prescription, or replacement of IUDs? This is a great question. Okay, women's health. Let's chat women's health. So like I said, pap smears are done in the office. That's included in your membership. When I send prescriptions, one of the questions here in your question is, what about contraceptive prescriptions? So anything sent outside of the office, that falls into the category of the things outside of the membership, right? So in the walls of our office, included in the membership, outside of the office means we're going to help coordinate the care for you, right? So if you don't have insurance, we provide our members with a discount pharmacy coupon for prescriptions, which basically makes medication prescriptions super affordable, like $5, $10, under $20 for prescriptions, generic prescriptions, including contraceptive medications. All right, so we help to coordinate the care to make it affordable outside of our office. If you have insurance, then you can use your insurance for all of the things outside of our office, specifically medications. You would just still give we'd send your prescription to Walgreens. You give Walgreens your insurance card, just like a traditional practice. Same thing at the imaging center. We have discounted cash rates on x-rays, MRIs, all of the imaging. You can choose if you want to use our discounted cash prices or if you want to use your insurance if you have insurance. So to answer your question about the contraception, we would have the discussion. Once you're a member, we have the discussion about what your contraceptive desires are. And if that's the birth control pill or the patch, for example, I would send that prescription to the pharmacy, and you would use either your insurance at the pharmacy to pay for that or the discounted pharmacy coupons for that discounted price. Okay? Now, IUDs, that's a great question. So we don't place IUDs and Nexplanons in the office. I do remove them. So I know you guys may have seen a reel I recently did where we did a Nexplanon removal. But yes, so I remove the Nexplanon, I remove the IUDs in the office. But because that has to be the purchase of the IUD and the Nexplanon has to be done through insurance, and we're not an insurance-based practice, we would either coordinate that with OB-GYN or we would coordinate the placement with the health department. Many of our members that get the IUDs and the Nexplanons placed, they'll go to the health department, get them placed, and then when they need it removed, I can remove it for them. So again, we help with the coordination, the care coordination of anything that needs to happen outside of our office. We make it smooth and easy for our members. And that's a big part of what's happening with Las Vegas. The Las Vegas healthcare is so discombobulated, if you will, and it can be so confusing. We have it all streamlined. So our members don't have to worry about, well, what happens with this or what happens with that? We've already got it covered for you. We already know the 5-star specialists in town. I have their cell phone numbers. We text. We get our members in. Like, we help with the care coordination. So we're truly your concierge style membership team that has it covered for you. So, but that was a great question. Thank you for dropping that question. All right, as you join, drop in the chat where you joining from. If you have any questions, we're doing a little lunchtime Q&A. I'm answering the top 5 questions that have been asked recently in our meet and greets, and I'm answering any of your questions live. Doc Trudy in the house, one of my favorite dentists in town. We refer to her as well at Crown Dental. So she said hi. So hi, sis. Welcome. If you have any questions, drop it below. All right. So I've got another question here. The Joy to the World says, I want to join, but I'm planning to move to Texas at the end of the year. Is there a month-to-month plan? So yes, you're talking about the end of the year. I know the year is going fast. We're about to come into May here, but that's plenty of time to be an Inspire Primary Care member and have high quality care. So absolutely, you can join the practice. We do have monthly or annual membership. So you would just join the monthly membership. For those who are joining with the monthly membership, we just have a 3-month minimum requirement in our practice because we're not meant to be used as an urgent care. We're meant for long-term care. So absolutely, as long as you plan to be a member for at least 3 months, you're welcome to join our practice. And we would definitely also, I have lots of DPC or membership style physician friends in Texas. So that's also another thing is when it is time for you to leave Las Vegas at the end of the year, I can help you get connected with some of the other amazing physicians that have practices like mine in Texas. So we've done that as well as our members have transitioned in and out of the Las Vegas area. So yes, would love to care for you. Don't wait. You've got some months left before you leave. So, all right. Thank you for that question. So Dr. Trudy dropped that she's from Vegas. Whoop, whoop. All right. We got a thanks. You are welcome. It's my pleasure. And then The Joy to the World said, I thought it was only annual. Cool. Yeah. So I guess that's a good thing why I go live so I can answer these questions. Yes, we have both options, monthly or annual. Okay. All right, let me answer question number 4 and 5. Keep dropping the questions, y'all. I've got some time before my next appointment. So, okay, the 4th question I was asked was about the team growth, Team Inspire growth. I was asked, will the personalized care continue to be the same as the practice grows? We see you guys are blowing up. So, first of all, thank you so much to the Las Vegas community for just really being receptive to this cool, innovative style of healthcare and seeing that, like, once you go to a concierge style membership practice with a practice that really cares for you, really cares about your wellness, really cares about the prevention and chronic disease prevention and reversal, really cares about getting you to a healthier lifestyle and a healthier weight. Once you see how the quality of that care is, there just really is no going back to a traditional insurance-based practice. Okay, so I'm so glad that the community has embraced Inspire Primary Care and embraced an innovative model. Okay, we're thinking Uber instead of taxis. We're thinking Amazon instead of like a traditional store. So in every field, the innovation needs to happen to make a better experience. And that's what's happening at Inspire Primary Care. So when you say you've seen we've been blowing up, thank you for that. And I'm just thankful to the Las Vegas community for opening yourselves up to something new that has allowed a better experience, right? And so the answer obviously to your question is yes, of course. We are committed to providing the VIP 5-star experience, whether we have 5 members or 500 plus members like we have now. It is all about maintaining the quality for our members. So yes, as we grow, we will continue to grow Team Inspire to accommodate the growth. Our practice model has 500 members per provider in our practice. Now, you might say, oh, that sounds like a lot. It really isn't, because in a traditional insurance-based practice, every primary care physician has at least 3,000 patients per doctor, which is why the average wait with an insurance-based office is 3 to 6 months in Las Vegas, because there's 3,000 plus people trying to get an appointment with the same doctor. So that is why we have a limit or a cap on our patient panel per provider here at our practice of 500, and then we add new providers at the time after that to grow and accommodate and serve more throughout our valley. So that's our business model. We're very transparent about that, and we are serious about the quality of our care and how fast we're able to respond and get things handled. We've made it very efficient, and we have a well-oiled system that is really accommodating the growth. So we're excited about that. Speaking of Team Inspire growing, okay, hint, hint, we're hiring a second provider. So if you are an amazing amazing is the key word. If you're an amazing physician, so MD or DO, if you're an amazing provider, so a PA or a nurse practitioner, we would love to care for you. We're looking for someone who is the right fit for our practice, who is obviously personable, who is passionate about primary care, wellness-focused care. We have had some amazing applicants already for this position, but we're not just going to be hiring one person. So the ball, as we continue to grow, we'll continue to hire. So we're excited to announce who our next hire will be, who's going to be joining Team Inspire next, but we do still have applications open for that because more positions will open up as we continue to grow. So stay tuned. We have an exciting announcement coming your way soon, but we are still hiring. So if you're an amazing provider who's burnt out in the insurance-based system and going through 30 patients a day and just being forced to give a pill or a referral and being forced to get in and out of rooms within 5 minutes, which is the requirement for doctors in the insurance-based office, then come over and join Team Inspire. We'd love to show you how we can provide a high quality of care and enjoy it on the physician side as well as enjoy it on the patient side. Okay, so yes, Team Inspire is growing. The quality of care will still continue as we grow because we'll expand our team as we grow. And then let's see, I'm checking the chat before I go to number 5, our 5th and final question. I'm checking the chat. So Dr. Trudy says, anything to help with perimenopause symptoms? I'm going to have to come back and do a whole perimenopause reel or live or video because I've been getting so many questions on this. I know Oprah recently did like a menopause special as well, which really sparked a lot more interest and question and discussions on this. That's a loaded one, which I love. Yes, the patient appointment I had or the member appointment I had right before this live was literally a whole visit specifically on perimenopause questions. So I love this question. Let me break it down simply in a short version, okay? A truncated version, if you will. All right, so because some people may be like, well, what's perimenopause? And okay, so let me break down the nomenclature first. So premenopausal means we're women who menstruate every month and we have a menstrual cycle, okay? And then perimenopause is the season which we're transitioning towards menopause, where we start getting some of us start getting some menstrual irregularities. You may start skipping months or you may start having heavier cycles. So that's the perimenopause symptoms, and there may be other symptoms in that season. And then you have menopause. Menopause by definition just means you don't have a menstrual cycle for 12 months consecutively. Once that happens, you officially have gone through menopause. The thing about this is people think that going through menopause or perimenopause means, I think it's with social media and all that, means that there's something that needs to be done. This is how God made us. Like physiologically, it's natural for our bodies to progress. However, we're all individuals, meaning that some of us have symptoms of menopause and perimenopause and some of us don't. Some of us have mild to moderate symptoms, and some of us have debilitating, severe symptoms. So what I always tell people is, I know you're going to probably expect this answer, right? But the really important thing is to get established with a primary care physician who knows you and who has the time to sit and answer questions and get a full picture of everything that's going on. Because sometimes it's not the hormones or it's not perimenopause. Sometimes it's the thyroid, in a healthy space. Is the weight affecting things? Is it financial stress? Is it, we look at the whole person and then look at, okay, or is this just the perimenopause or the menopause actually causing the symptoms that you're having? So main thing is talk to your physician and ask and let them know specifically what symptoms you're having. This is based on symptoms. Let them know what symptoms you're having and how it's impacting your quality of life. And then that will help guide the discussion and the treatment options that are appropriate for you. This all should be customized, okay? And when you ask about symptoms, when it comes to the symptoms and what to do about it, there are lifestyle recommendations. We give all of those. We talk about all of those with our members. And then there are non-hormonal or even supplement options. We talk about all of those. And then there are medication, hormone replacement therapy discussions. And then it's really important to talk about the pros and cons and weigh the risks and benefits. So it's a really detailed discussion. So I'm glad we just touched the very cherry on top for that. I hope that got us started on that, Doc. But yeah, this is my plug to say, connect them or the person that's asking this question, or if it's for you or whoever, to Inspire Primary Care so we can really have the time to sit down and have this discussion in detail. Oh, that was a good one. And then question number 5 I see a couple more joining. I have a few more minutes, so drop in the chat where you joining from. If you have any questions about Inspire Primary Care, drop them below. Happy to answer your questions. I'm going to answer question number 5. Most common question we've been asked lately is, how do I join Inspire Primary Care? And I've been getting asked this for individuals and for business owners who are interested in the corporate membership. So let me break that down. If you are an individual, so a busy professional is perfect for our practice. So busy professionals, families, individuals who are interested in joining Inspire Primary Care, you can simply go to our website. So it's inspireprimarycare.com. No I in front of Inspire. There's a big enroll button shaped like the Las Vegas sign. You click it. It takes you through the steps to join our practice. Okay. So that's how you join our practice. We are now enrolling new members for the month of May. That still feels crazy to say May already, but we are enrolling new members for May, so you can definitely go through the website and join our practice there. If you have questions and you're like, I think I want to join, but I have some specific questions and I didn't answer them in this live with the commonly asked questions, you can always schedule at the top of our website as well. Underneath the enroll button, there's also a button that says schedule a free meet and greet. So if you click that button, there's an option to schedule a free virtual 15-minute meet and greet with me or my team. And we will answer any of your personal questions that you may have that may be more, customized to you as an individual in your situation. So we're happy to do that. We want to make sure you're a right fit for our practice because we want you to enjoy, the benefits of Inspire Primary Care. Okay. And then if you're a business owner and you're like, how do I learn more about this corporate healthcare option for my team, for your team? Okay. Again, our corporate healthcare benefit is perfect for business owners that have a team of 5 to 30 employees are perfect. We're going to be saving your business money. We're going to be providing a benefit that you cannot get somewhere else for your team, keeping your employees healthy, and offering them a concierge style benefit that they are going to love. So if you're a business owner who's been struggling to have a quality option or an affordable option in healthcare, Inspire Primary Care is your solution to that problem. We'd love to care for you and your team. You would just also email us at Inspire. If you go to inspireprimarycare.com, no I in front of Inspire, and go to the contact page, just email me through that. And my team will get back to you to schedule a corporate meet and greet. If you're watching this on socials, you can always DM me the word business, and then I can get you the corporate membership option as well. But just reach out. We're on all the social media platforms. Our email is available on our website, and we're easy to reach. So happy to answer any other questions. I'm scrolling the chat, y'all. I'm scrolling the chat. I enjoyed this lunchtime chat. Did y'all enjoy me being back? I know I'm glad to be back. Okay, so we'll keep the live going from time to time. As anytime I'm not working through my lunch break, I'll pop on and say hi and answer questions that you all have. I'm scrolling the chat. I don't see any more questions. So thank you so much again for joining me. Again, Las Vegas is my hometown. It's been a pleasure to provide my hometown with quality primary care, and we are growing. We're going to continue expanding this quality healthcare mission, wellness-focused healthcare mission throughout the Las Vegas Valley. And if you're a business owner or an individual, it's inspireprimarycare.com, and I'd love to care for you, and so would my team. Take care. I'll see you next time. Bye.